Hello, everyone. It's Wednesday, March the 10th. I've got some news to report in just a second that is really disturbing. But I've also got to say that we have lost 5 additional people in West Virginia. I'll read these in just one second. I mean, that number is terrible that we've lost 5 people, but considering that we've only lost 5 people since Monday, you know, the way this has been going, that's a great trend and a good number. Again, I'll get to what I was referred to as an event that's just been brought to my attention in just one second, but let's give all the respect to these families and all the loved ones of these 5 great West Virginians that we just lost. Our 2,326th death is an 87-year-old female from Kanawha County. Our 2,327th death is an 80-year-old male from Upshur County. Our 2,328th death is an 85-year-old male from Jefferson County. Our 2,329th death is a 93-year-old female from Kanawha County. And our 2,330th death in West Virginia is an 82-year-old male from Ohio County. I keep saying the same thing over and over. Don't let these people become a number. They're so great as far as great West Virginians that we've lost. We've lost an unbelievable amount of wisdom. The youngest of these 5 people are 80 years old. The oldest was 93 years old. You just think of all that they've contributed to all of us in West Virginia, so please remember them. I want to go through just a couple of numbers and I'll get back to this other thing, but our daily positivity rate's 3.19. Our cumulative continues to fall. It's down in the 5.3s. Now it's 5.36. Our active cases are 5,360 in West Virginia. It's 53 straight days that we have seen less numbers. Our recovered cases are 468. We've jumped up a little bit in our hospitalizations. We're at 178, but our ICU unit patients are 54. We have no red counties in the state of West Virginia, and now I want to get to something and this just crawls flat all over me. That's all there is to it. I've just been told, and you know that every single day that I come in front of you, I want to be 100% transparent and always tell you the truth. Some days it's been a whole lot tougher than others, and this is really tough right here. You know, in fact, there's no excuse for this. There's no excuse whatsoever. The DHHR just learned that 70 of our healthcare facilities across West Virginia have not reported all the COVID-related deaths that occurred at these facilities. And this is totally unacceptable in every way. On Friday, you know, I will honor all these great West Virginians that were unreported. And get this will blow you away. I think there are 168 deaths that have occurred in West Virginia that were not reported by these facilities. Dr. Amjad will go in more detail because I just got this. But this is coming from people that have passed away from at home. This is coming from hospice. This is coming from our hospitals. This is coming from our nursing homes and assisted living. And there's been 2 at our jail facilities that I think went on to hospitals and then died. The information was not reported and not reported on to DHHR. Now, I promise you this, that this kind of stuff is totally unacceptable to me. And I'll dig and push our people to dig in every way to get to the very bottom of this. The overwhelming majority of this is coming from the hospitals. Half of this is from our hospitals. I don't get it. I don't get this at all. This is absolutely not acceptable. But nevertheless, let me go on. Dr. Amjad will take over in this in just a few minutes, okay? That's terrible. On Friday, you know, I spend an incredible amount of time because I think it's the honorous thing to do. You know, I always read these people, their gender, where the county, their age, where they're from. I always take real time to honor them because we should. I don't need a pat on the back for it. We should. That's exactly what we should do. How in the world could we have 168 great West Virginians that we just passed by? It's awful. It's just plain awful. And I don't know how in the world and what our people are doing, and I don't know that they're our people, hospital people, hospice people. I just don't know how in the world we could just let that go. And by our people, I mean West Virginian people. You know, not people necessarily that are working for me, but I don't get it. And so on Friday, when I get all this stuff put together and everything, I'll read every one of them. And I'll do it with great honor, but at the same time, it's just a crying shame. That's just all there is to it. Okay, I got to get back on balance here, but I hate that, and I'm really sorry. I'm really sorry. You know, going back, if you're older than 65 or 65 and older and you have any kind of health condition that comes up that's unusual and everything, please go get a test. The antibodies are waiting on you and everything, and they can absolutely knock this thing dead, and they can get it gone and everything before it really grabs hold of you in a bad way. You know, the restrictions that were lessened on Friday, we lifted the capacity restrictions on restaurants, bars, small businesses, retail stores, gyms, fitness centers, and more. And as long as we keep that social distancing, we'll be able to maintain this and everything, we surely hope. You know, we raised the social gatherings to 100. We allowed travel sports if you're not in a red county. And the only thing is, one thing we're going to have to do, we're going to have to continue to wear these masks. I've told you over and over, I surely don't like them any more than you do, but with all in that, let's just don't absolutely try to run before we crawl. You know, we're crawling and walking pretty decent. Let's don't take off running right yet and everything. Just a few more days, you know, and please let me, allow me to continue to listen to the medical experts and let them give us information and everything and guide us through this. You know, from the standpoint of the guidelines, you got them all up there as far as your face coverings and all that. On the vaccine distribution update, we're at 97%. We're, you know, of our first and second doses. Our goal is always 100%. We've now got in arms 565,669 total doses. We continue to lead the nation over and over. We're 12.2% of our total population vaccinated with both doses and everything. In West Virginia, if it were a country today, would rank 12th in the world. You know, you can't beat all that. From our vaccine scheduling system, everything is all up there. We have counties that are still lagging a little behind. I'm going to read them. We need you to help get these people registered in your county and everything, so we'll be able to help them. That's Gilmer, Calhoun, Clay, Wirt, Doddridge, Webster, Pocahontas, Grant, Pendleton, Braxton, Wyoming, Pleasant, Tyler, Tucker, and McDowell counties. We need more participation out of those counties. Please listen to me. Please, please, please continue to help us in getting people, you know, signed up. We have now signed up 362,000 West Virginians. That's pretty good, but we could really do better. From a standpoint of us saving our wisdom clinics and everything, they're going on in all 55 counties, and you got to watch about the weather and everything. We'll update you, but now get this number, and this number just is the number. 198,835 seniors, people of 65 and older, have had shots now, and 116,339 have had their second shot. We saved a bunch of lives right there and everything, and that's great work by all the people from our communities to our local clinics to the DHHR, the National Guard, all the people that have done phenomenal work in regard to that. As far as the vaccine info line, it's up there and everything. From a vaccine reminder, surely I hope that Mark Curtis hadn't started to grow antlers or anything yet, but nevertheless, don't listen to these crazy things that people come up with. The vaccine is incredibly safe. We need you to take it. It'll protect you. It helps us. Please listen to me on that. If you have any kind of issue, all the free testing is up there. All the free testing map is up there. The drive-through pharmacy people we thank in every way. Our long-term care facility outbreaks, we're down to five long-term care facilities. It's amazing. But we have bounced up a little bit on our churches. We have 3 active cases in our churches now, one in Monongahela County, one in Raleigh County, one in Nicholas County. And so we want to really, really be on guard there. You've done an amazing job and everything. Let's don't drop our guard here. We got to stay on guard because we know the church facilities are a right place for a real issue. So we've got to really watch what we do right there. At corrections, we still have 223 inmates and 13 staff, and of them, 208 of them are at Western Regional and 15 are at Southern Regional, and we know when we get this into one of our correctional facilities and everything, it goes like crazy. We run to the fire, we extinguish the fire and everything, but we've got to really be careful there as well. Our face covering requirement, I've told you about that. I ask you over and over to consider giving blood. It is really important, and you're saving lives, and absolutely, especially if you have recovered from this dreaded disease, and as I believe with all in me, you have at least an obligation to consider giving blood. We need it really bad. I've signed a proclamation today declaring today as Arts Day in West Virginia. Normally we would do this in conjunction with History Day, with the legislature, but we've got to do it like we're doing it here online and everything. I want to just pause just a second and tell you a little bit about the arts. At one point in time, really, there could have been a time when we could have decided, well, we really just got to cut. We got to cut areas, cut. And we would have maybe lost our arts or our funding for it. Well, just imagine this. In West Virginia, in the arts and cultural industries, there are 17,250 workers with wages totaling $900 million. They add $1.5 billion to our state's economy each year. And the arts and creative occupations represent 19% of the West Virginia workforce. Now you tell me, should we not absolutely be proud of our own pond? That's what we did. When we were right on the verge of maybe cutting, we didn't do it. And we have pumped more money into our arts, our culture, and all the different things that go on, and they're led by a curator that is the leader of the band, Randall Reed Smith, and what a job he does. He's not a big man in stature, but honest to goodness, he's got a heart that is as big as Texas, and he's stuck on all the time. I thank Randall so much. I celebrate this great day because this great day is us being proud of our own pond. So I congratulate all those that are involved in the arts, and I just want to try to continue to support because it is really meaningful to this wonderful state. Now, one other thing I've got as an announcement is the Mountaineer Challenge Academy South has its first graduation tomorrow. 50 cadets will graduate from the inaugural class at Mountaineer Challenge Academy South. That became a reality just not long ago, did it not? And look what has happened. You know, this is really the 55th class that we've graduated from the Mountaineer Challenge Academy system, North and South together. And it is amazing, if you'll just step back, if you ever had time, and you could just, you know, call up the powers to be and maybe visit, and just see how these young people, and sometimes a little older, are going through, they're learning trades, they're maybe having issues that are going on in their lives and everything, but they're getting rid of those issues, and they're becoming wonderful, productive individuals. I mean, absolutely, as their governor, I congratulate them in every way. It's tough stuff. I mean, really and truly, it's tough stuff. But these people have decided that maybe they were on a pathway that wasn't all that good, and maybe this is a pathway that they needed to be on, and these key people have made a decision that was tough, and at the end of the day, they're on a pathway of goodness. I congratulate them from the bottom of my heart. So anyway, nevertheless, we're going to continue to go forward. We're going to continue to be transparent. We're going to absolutely tell you the good and the bad. And without any question today, I had to tell you something that's bad and totally unacceptable to me. Dr. Amjad will talk about it in just a few minutes, but I'm not going to tolerate this kind of stuff on my watch. I'll promise you that. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Aina Amjad, our State Health Officer.
Thank you. Good morning. So as the governor mentioned, the DHHR did learn of about 168 deaths to date that were reported to us late on Friday. This was due to approximately 70 facilities throughout the state, comprised of in about 30 counties. It did consist of mainly hospitals and nursing homes mainly that did not report the deaths according to our policies that were set in April of 2020. These protocols are in place so that we can accurately report COVID-19 deaths to the state of West Virginia. These deaths did become apparent to us once mainly death certificates did come to our vital registration endpoint. So we have these protocols in place mainly so that we can accurately report COVID-19 deaths. We do understand that there is a time lag when there is a surge in the state. However, we have these protocols in place that are pretty easy to follow, that we have been encouraging facilities to participate in and have been reminding them of such. So right now, we are very disappointed that these facilities have not done this accurately. To us, you know, we do have ways of following up with them. Right now, we have a list of all the facilities that have not reported this properly. We're going to be reaching out to them in order to help them facilitate this, because to us, you know, 168 deaths isn't just about data collection or names. As the governor mentioned, he does take time each briefing to honor each West Virginians because it is important to them and their families to be recognized in our state. But to us, this is extremely unacceptable because we are also trying to keep track of every West Virginia individually and properly in the state. So right now, as we speak, we are going to be reaching out to each facility in the state, reaching out to the infection control nurse and the physicians in charge to see how we can fix this. In addition, this reporting was done on a biweekly data match to count these data sets. We're going to shrink that time frame to make it a weekly data match so that we can accurately report those and catch those quicker if possible. But as the governor stated, this is unacceptable to us at DHHR, and we apologize for that, and we're going to honor all these individuals on Friday, as the governor stated. In addition, we did have one other thing to mention on our COVID vaccine 19 call line. We did have some complaints of an individual who was not answering questions, I think, properly. We did remove that person from the call line as well. We do want people to feel comfortable when they call our call line and not have any problems with that as well. So we did take care of that situation. I think we had some issues with that, but that's all I had, Jordan. Thank you.
Thank you, Doctor. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you and good morning. Certainly, as the governor has said and Dr. Amjad just reported, we pride ourselves for transparency, and this is very disappointing. We want to make sure that we are accurately tracking the deaths and also hospitalizations and other metrics so that we can continue to understand the impact of our strategies. And with this is something that absolutely needs to be fixed right now. It's also important to recognize that we continue, though, to see improvement week to week with the strategy that we've taken related to the deaths, the hospitalizations, the ICU stays, and for people in West Virginia. The governor said this many times, but I think that it is really important that by staying together and staying patient and being altruistic to make sure that we are able to vaccinate our highest risk population, our nursing home population, our elders, people with coexisting medical diseases, and protect our essential workers, including people working in hospitals, people in first responder areas, certainly people working in education. Those things have really enabled us to be recognized as being at the front of the pack, being the trendsetters, pushing the envelope, continuing to be very cautious and careful on the standpoint of protecting health and outcomes, but also being aggressive and making sure that we are opening businesses and getting our children back to school and keeping our older students in higher education schools so that we don't lose a generation. We also know that the CDC has come out with new guidelines, and just to make sure that all West Virginians recognize this, for people that are fully vaccinated, people that have received 2 doses of either Pfizer or Moderna and are at least 2 weeks after their second dose, which is the time that your immune system is fully activated and giving you the immune response, then the CDC, and let me just point out, and for the Johnson & Johnson vaccine, 2 weeks after the first dose, because it's only a 1-dose vaccine, then if you're around other people that are also fully vaccinated and 2 weeks out from Pfizer, Moderna, or 2 weeks out from the 1 shot of Johnson & Johnson, then everybody is okayed at this time to be around each other, to take your masks off, to be able to be together, to hug each other. And similarly, if you as an older West Virginian and somebody who's vulnerable has been completely vaccinated and you're 2 weeks out and you want to go visit your family or your grandkids, then as long as everybody is in a low risk setting, and that means they haven't really been around people with COVID or in high risk areas and they've been wearing their mask and all that, then you're also okay to be around each other without masks on. But if you're with multiple different people, some of whom have not been vaccinated, some of whom who may have higher risk activities, then the recommendation is that everyone should wear their mask and again, stay physically distanced. It's also been guided by CDC that if you're fully vaccinated and 2 weeks out after your last vaccine dose, then if you're around somebody who is diagnosed with COVID-19, you do not have to quarantine as long as you do not develop any symptoms. If you develop symptoms, of course, you should quarantine and get tested so that we make sure that we are able to provide you the best care and the best treatment. So we are doing well. I commend Dr. Amjad and the governor and our team for making sure that we are being transparent. You know, we've talked about COVID as the most complex operations event we've ever had. And we also remind people that you still need to be careful. I think the governor's been very wise in maintaining the mask commitment, particularly on indoor mask wearing in businesses. And to that end, we've just identified now our fourth case of the United Kingdom variant of the virus, and we've identified some California variants of the virus. So we're not seeing the explosive growth in the United Kingdom variant as some states are, but it is a reminder to us that we constantly need to be vigilant and make sure that we're caring for ourselves. And when it is your turn to be vaccinated, and we will be opening up more and more as we go forward, then please choose to be vaccinated, because that's the way you stay safe and keep West Virginia safe. In the meantime, wear your mask and stay physically distanced. Thank you.
All right, thank you, Dr. Marsh. Retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force, and Secretary Bill Crouch with the DHHR are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. About these unreported deaths, it sounds like we have reached out to these facilities. We're making efforts to ensure this doesn't happen again in the future, but are there any other kind of repercussions or accountability measures that these facilities will face? And then at this point, until we dig more into this data, do we know that 168 is a definitive number? Do we expect to find more of these as we investigate? And because of that, does this warrant a full-scale audit of all of our COVID data going back? I know we've had a couple of incidents where, we found unreported numbers or cases were still on the active list when they weren't. We had the issue with jail cases. I just wondered if this, warrants a comprehensive overview of all of the data. Thank you.
Well, Charles, let me start out and let me just say this, that, I think you asked really if as to what level of disciplinary action or whatever it may be, that should be imposed or whatever, and the overwhelming majority of this it's all private stuff, and but gosh, it just makes me sick. That's all there is to it. I don't know how in the world, as hard as all of us have worked, now, if our people are not following up and not checking on this like they should be, then we got a problem in-house, and I'll really not be happy with that either. But if really and truly these facilities, as sophisticated as Kanawha County is, and Kanawha County is very sophisticated and done a lot of good work and everything. But as I understand, there's 30 in Kanawha County, and it's just not, there's no way in the world that I can say anything other than the fact that, all these great people that are around me here and throughout our state, but especially the ones right here around me, we work night and day to try to make these numbers and all this stuff just work as great for West Virginia as we possibly can, while being 100% transparent. And then something like this comes right out of the blue, and it hurts us. It hurts us. And so it's just plain, it's so disgraceful to those individuals, and it's just not any good. So I'll go back to Dr. Amjad. Dr. Amjad, maybe you can answer it better than I.
Sure, Governor. To answer your question simply, there's a delay because of death certificates, Charles. So if people don't fill out our death reporting, which is required, and as the governor stated, it's mind-boggling that people don't, because it's a very simple process. It's basically a one sheet that you would fill out that's on our DHHR dashboard that we have reiterated repeatedly, for the past almost 1 year now. And to me, as a physician, if I had a patient who passed away, I'm responsible for their, certifying even their death certificate. And now we've required people to fill out the death report. So to me, when I even look at this list and I see, the majority hospitals or nursing homes, I feel the same way, that why can't you fill out a death report so that we can get these numbers quickly? So Is there any penalties? As the governor stated, we can't say anything right now, but we need to find out why these 70 facilities have not done what we asked for, because we want these numbers to be as accurate and timely as possible. Are there more numbers? We don't know, in the sense that we wait for death certificates to do a lot of confirmation. As we speak now, we are trying to find a way to hold people more accountable or feet to the fire, because we want numbers faster. I just spoke with even our team right now before this briefing, because it's March, because we do not want to have numbers like this again. You know, these are bi-weekly data matches. We are going to shrink that. But as I said, you know, a lot of confirmations come from death certificates, which are the confirmatory. But to me, filling out a one-sheet death report takes 1 minute. And as a physician, I would be responsible for that. I'm not going to trump that to an infection control nurse or someone else in my facility. So, you know, you have a lot of facilities here who are going to probably point fingers in their facilities and say someone else should have done it. But we're going to look at a lot of these facilities, you know, hospitals and so forth, to find out why did they not fill out this death report that we want, that we have asked for, and we have been repeatedly asked for and reminded people to do, because this is totally unacceptable, as the governor has stated. And these numbers to us, when we saw them, are, to me, you know, gut-wrenching when I saw them as well. So that's just, I can't say more to that, but there has to be another way around it, because these numbers can't come out again like this.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. I have a couple of things that come to mind when I reflect on what the governor and what Dr. Amjad have both said in this briefing. One, Governor, there was a toll-free COVID hotline worker removed from a position because they were improperly answering questions. That's something that we brought up with you in the last briefing. Did this come as a result of you checking into the COVID hotline situation personally? Have you had a chance to do that? What's been your work over the last couple of days in trying to get that thing ironed out to get answers for West Virginians who call it and need those answers desperately? And the second thing that comes to mind is we're still waiting for the final report on the elder care nursing facility in Jackson County, where there was some questionable response from the state early on in the COVID pandemic, and resulted in a large number of people dying, or at least could have possibly contributed to a large number of people dying. What's the latest on the Jackson County Elder Care Health Report, and when do you foresee that report being released to the public? Thank you.
Well, Kenny, the answer to your first question is yes. You know, and I immediately went to Secretary Crouch and had him investigate, and the report was well-founded, and that person was removed immediately. You know, it's just, I mean, anything that comes to my attention, I'm going to act on it, and I'm going to act as quickly as I possibly can. From the standpoint of the Jackson County situation, the state police have investigated it, and the initial information was that there was no criminal activity, but we're still awaiting the final report, and we'll get that. And but that's really what I know about the Jackson County situation and the situation that you referred to before. You know, that person was, we confirmed what you were saying was correct, or the people were telling you that was correct, and we acted.
All right, thank you, Kenny. Next to June Leffler with West Virginia Public Broadcasting.
Hello. So I have a really, really quick question, and then my actual question. So when I look at the portal, it says 2,330 deaths in the state. Does that count the 168?
I do not think so, but Dr. Amjad, you know, please go.
June, it does not yet.
Up question, which is a little tangential to what we're talking about right now. This would be for Hoyer. I'm really interested in what the state and local health departments are doing to as far as transportation is concerned when it comes to getting the vaccine out. So as far as folks that are homebound, folks that have disabilities, and even folks that just don't have access to transportation. I'm sure all the local health departments kind of have their own protocols that they're doing, things that they're looking into. But can you just give me a sense of what's happening throughout the state?
General, can you answer this question, please, sir?
Yes, sir, Governor. So yes, June. So it's a combination of different efforts based on the counties. Some counties have been using county staff directly to work with getting to homebound population. Some cases in our community-based efforts, pharmacies have been doing that, particularly some of our independent pharmacies. We also are establishing some additional mobile clinics that, in addition to working with those manufacturers, mining facilities, and others, will be working with the homebound population. We had a list initially of 4,000 individuals provided to us through senior services with the homebound list that we continue to work with the counties on. So a number of different fronts to get to those populations.
All right, thank you, June. Next to Mark Curtis with Next Star Media.
Good afternoon, or good morning still, Governor and panel. And Governor, let me ask you this question as not only governor, but as a coach. We had a number of high school basketball games across the state last night, and we're getting some anecdotal reports of some teams with players sitting on the sideline on the bench without wearing masks. Some were wearing masks. Some people in the crowd not wearing masks. Some people in the crowd were wearing masks. What is the guidance on this? I know that you defer to Bernie Dolan and the local school districts, but we're seemingly having a hodgepodge of behavior when it comes to high school sports in terms of not only the players, but the audience wearing masks or not.
Well, Mark, I can tell you that I mean, my team played last night. I'm not watching every single thing every moment, but we're spread out the way we're supposed to be spread out. I think we're wearing masks. We're not, I mean, I surely wore a mask the entire game. I can tell you that I watched in the crowd and everything, and I didn't look close enough and everything, but for the most part, I can't recall seeing anyone without a mask. However, I am sure, just as sure can be, that that if we don't watch out and this thing becomes lax, like you're saying, and it can, we're going to have a problem. That's all there is to it. We're just going to have problems. You still got a lot of really stubborn people out there. And people that believe, you got a lot of people that believe, spring's here, all's good. And we know the experience that we got into with the football and everything and what we had to do. And because the travel and everything else causes issues. That's just all there is to it. And from every incident that's been reported, the SSAC is telling us that they're checking up on it and everything. But we have got to try with all in us to buckle up and make it as safe as we possibly can. Now, I am an advocate to go ahead and have the sports, but if we can't buckle it up, we'll revisit and look at tightening it back down. But to be perfectly honest, you've got people that are at the schools and should be at the schools, whether they be, the administrators that are from the schools, the principals and that are at the schools, the athletic directors, even the superintendents, they should be checking on these matters. Your coaches should be watching your team, but the coaches are not responsible for the for the people that are there in the stands, and who knows who's walking around and everything. It could be a custodian, it could be anybody. But the coaches have got to be able to handle the game. You know, beyond that game and everything, they got to have some help. And you know, when it gets lax, we're going to end up with real problems.
All right, thanks, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, on Monday, you had harsh words for Senator Joe Manchin. Part of those words said that the former White House would not even take his calls. Does your office take his calls? And to go a little bit further, part of your statement included a reference that he was profiting from his position. Do you stand behind those remarks, or were they just made because you were mad?
Well, Paul, I don't make many remarks because I'm mad. You know, I would stand behind this, Paul. You know, first of all, I would take his call anytime. You know, this is not prompted by me. You know, really, if you'll just step back and think about it, you know, questions on the national scene have come out over and over where they've been driven from. They've been driven from Joe Manchin. You know, we spent CARES money for, you know, his comment was, I've never seen a pothole that was a COVID case. You know, we spent money so people could get to the hospitals where slips and everything were, that people had to drive 45 minutes maybe around in a direction to get to a medical facility. We tried to absolutely help those people, did we not? Then we went through all this barrage from Joe Manchin saying that the money wasn't being sent to the counties. The CARES money wasn't going to the counties. And lo and behold, we were ranked 4th, right while he was saying 4th in the nation in how we got the money out to the counties and everything else. And now you've got a situation that, and on top of that, we sent to the counties and the cities $260 million. Now, Paul, I'm not the one making this up. I'm not the one saying this stuff. And then he sent texts and memos to all of the Dems and everything around here that's basically saying this, that I, Joe Manchin, put verbiage in the new stimulus law prohibiting anybody from getting any stimulus dollars, period, if they were going to use that in any way to lower taxes. Well, why would he do that? Why in the world would he do that, Paul? He's doing that just to hit at me. That's all there is to it. Let's just tell the truth. You know, and in doing so, who's really the loser? West Virginians. West Virginians are the loser. You know, on one hand, you could say, Joe Manchin doesn't give a hoot about West Virginians. Joe Manchin is still all riled up about losing every county in the state in the last election. You know, not his election, but my election. You know, and I was, for all practical purposes, running against Manchin. I wasn't running against Salango. But every one of these attacks come from Joe Manchin down to me. All I'm doing is responding. Now, your other question is just this. Be honest. Be honest. I mean, Joe Manchin is ranked by Forbes or whoever it may be as a wealthy guy. How could that happen? I mean, how in the world could it happen? On the salary that a politician is paid? I mean, it's the same thing all across the board with all politicians. All the politicians, there's a reason why people want to be a politician. Because they want something. They want something for themselves. I never have. I never will. I don't want a thing. Everybody knows that. But if you go through politician after politician after politician, many of them have grown enormous wealth, and they've done that how? They've basically sold influence. That's what they've done over and over and over. You know, people, lobbyists and everything, of which I'm not to just tell it like it is, this is not what our founding fathers did. You know, Paul, and while I'm on this, I'm going to just say this and everything, but if you'll go back to our founding fathers, many of them left their farms and everything else and went to serve. And many of them ended up bankrupt. Many of them gave up everything they had to serve. Today, you know, even as we speak, our people, we need to serve first and foremost. You've got lobbyists running everywhere, enticing people from our delegates to our senators, to our House, to our senators. On a national scene, you have them everywhere, throwing money at everything coming or going. And our people have become a society that the money rules. It rules. Well, I don't think it ought to be that way. I think our people should have guts, and they should be here to serve, and they should do the very thing that is the best for all of our people, and not the best for us, for an individual, a politician. And absolutely what, in my opinion, should happen here is Joe should crawl out of the childishness, you know, about what's going on with me and government here, and quit just trying to hit, because every time he tries to hit, he either hits wrong or he hits West Virginians. Now that's how I feel, Paul. You know, I will always take his call, and I welcome working together. I welcome laying all this childishness away and aside. I can't answer you any more bluntly than that.
All right, thank you, Paul. Next to Autumn Shelton with the West Virginia Daily News.
Hello, everyone. How did you discover that 168 West Virginians' deaths had gone unreported? Will you be releasing a list of those facilities that did not report? And also for Dr. Amjad, I would like a clarification for those who may still be concerned about getting a vaccine. What are the differences between the three vaccines, Moderna, Pfizer, and Johnson & Johnson?
Let me answer the first part, Dr. Amjad. I found out about this 45 minutes before this briefing. That's when I found out about it. From the standpoint of releasing the names of the people and everything and the facilities that this happened in, absolutely. Absolutely, they ought to all be released. You see, I am just what I've told you over and over. For good or for bad, I tell you the truth, don't I? I'm never, ever going to try to sugarcoat or hide something, and I'm not going to do it. I'm just not going to do it. So 45 minutes or an hour before you've seen me today, that's when I found out about this. Dr. Amjad, answer the rest of it, please.
Sure. We have a biweekly data match with our Health Statistics Center and our Bureau for Public Health that captures all our data for our COVID-19 deaths and then our death certificates of the state. So this data match captures those two data and puts it all together. So as the death reports come in and the death certificates comes to our vital registration system of the state, it has to reconcile that, and that's when December and January reports came in, and they saw that all of the ones that we have for death reporting, which comes in a timely manner, and the death certificates, those were not reported. So that's when those numbers did come in. And we have to keep in mind, December and January is also when these facilities have an increase of patients and also people coming in. So that is not an excuse, and it's not one that we are also going to take for people not reporting the deaths in timely manner to us. But that is why we did see those increase in numbers to our vital registration system is how we get those numbers in. Death certificates normally do take anywhere from 6 to 8 weeks to be reported into the system, which is why we do not like to use that for our COVID-19 reporting, which is why we asked for the death reporting system, which is pretty much a one-page way to report numbers to us, which we get it faster. That's why we don't use the death certificates, because it takes up to 6 to 8 weeks to report deaths to us. But because of that time lag, these numbers came in late to us. But that's why we had that other system in place since April of last year. So hopefully that helps answer that question. And to answer your question about the vaccines, Pfizer and Moderna are both mRNA vaccines. And then the Johnson & Johnson is a viral vector vaccine. It's a one-dose vaccine that has been out. And as of now, I mean, I don't know how much detail you want of those. You know, the Pfizer and Moderna are both, 21 and 28 days, two-dose vaccines. Johnson & Johnson is a one-dose one. Pfizer is 16 and older. Moderna and Johnson & Johnson are 18 years and older for right now. All three are available in the state of West Virginia at this time, and depending on the age category that we're at this time due to our phases. I'm not sure how much detail you want right now. There's a lot of information out there. We have a lot of information on our website with toolkits and available, but hopefully that answers some of your questions. Thanks.
All right, thank you, Autumn. Next, we'll go to Brett Dunlap with the Parkersburg News and Sentinel.
Yeah, Governor. Wanted to ask, and please forgive me, this came to me about 10 minutes before you came on, so I haven't had time to research it any, but some people with our organization in Ogden seem to think that Everbridge might be pulling out their services, and they wanted me to see if what was going on there, if there was truth to that or not. As I said, I haven't had a chance to look into it as I got the question about 10 minutes before we came on. So, Governor.
Okay, Secretary Crouch, maybe you can answer this. If not, General Hoyer could, please.
Yes, sir, Governor. I had this similar question last night on a call with the local health officers in the state, and my answer then was that we have no plans to replace Everbridge with something else. What I did talk about is as the system progresses, and you hear the governor every press briefing talk to the issue, address the issue of not enough people registering in the state vaccine registration system, which uses Everbridge. That is the issue, really. We have, again, 13 counties that have less than 100 individuals age 65 and over to vaccinate. So I know Grant County is doing a great job of pushing that out, using their own, their folks in the county to try to promote registration on the system. So as we move forward, as we vaccinate more people in all age groups, we're really pushing to get those 80 and over and 70 and over and 65 and over. And we're expanding who is eligible for the vaccine. So as we move forward with that, if we don't have enough people registering on the system, there will be a transition to more of a routine immunization program that CDC pushes out for flu vaccine, et cetera. So that's what we're looking at, but there are no plans right now to change to another system or change what we're doing, but we need people to register in the system. We really need to focus on getting everybody that we can vaccinate vaccinated. So thank you for that question.
All right, thank you, Brett. Governor, I'll turn it back to you.
Okay, let me follow up just 1 second on just that. You know, I think Secretary Crouch, hinted towards, getting people registered, and in certain counties, maybe only even 100, and I don't know about that, but, that have been registered into the system and so on. And basically he's talking about the fact that we sure can't get them in arms if we don't have arms to get them in. Well, think about this just 1 second, because here's something that's for real, and it's just, if you'll think about when this all started, when everything started, if you'll think about it in the terms of a business guy, it was a demand problem. And what do I mean by that? Here's what I mean by that. You had vaccines coming and vaccines arriving, and people couldn't figure out how to create the demand on who was going to get the shots. All across this country, everybody just, sat around, and didn't have any idea. And they were trying to develop a system and on how and who to give the shots to. So it was really more of a demand issue because of their ineptness. Now, West Virginia, thank God we didn't go down that route, and we immediately started to be able to identify this was an age problem, and we really got after it. But in the beginning, it was more really, truly of a demand because the supply was in the warehouses, and they weren't getting the shots out. Then it shifted completely to a supply issue because all the states learned an awful lot from West Virginia, as well as the CDC, and then it became a supply problem, did it not? We were screaming, we need more vaccines. All the other states were doing the same thing, and they, in many ways, adopted our program. Even the federal government came out and said, let's use local pharmacies and on and on and on. Let's use our National Guard and everything else. And the supply problem then became, that we just didn't have enough doses. Nobody had enough doses. But you know what's happening today? Today, we are becoming the demand problem again. You're going to have the amped up doses to where the vaccines are available, and if we don't watch out, we're going to get caught, as everybody across this country is going to get caught, in that we don't have a methodology set up to be able to get them in somebody's arm right then. And I'm not going to tolerate that. We have got to figure out a way to be able to get them faster in arms, because now we've gone from a demand issue to a supply issue back to a demand issue, and we've got to respond. We have to respond. So today, on March the 10th, we very, very, very gratefully, to the blessings from God above, only had 5 deaths. Those 5 are terrible. I got that. But on this same very day, too, we find out that we've got 168 West Virginians that we're disgracing because we have failed to get them reported. It's a crying shame. That's all there is to it. We have well over 2,330 deaths now in the state of West Virginia, and that's tragic. While it looks good in lots and lots and lots of different areas, and it is truly good, we absolutely mourn all those people. And so I just promise you that all of our people will get to the bottom of any deficiencies. And when I come back in front of you on Friday, I'll read every one of those deaths that come to me, and as I will going forward. Now, I hate this. I really, really hate this. We have done so well, and we're going to continue to do well for all West Virginians, because that's the only way that I know to do it. This is not about me. This is not about anybody, from Dr. Marsh to Dr. Amjad to General Hoyer to Secretary Krause. This is not about anybody other than just trying with all in us to do everything we possibly can to help the people of this great state. It's been a real honor. It's been a real, real honor. And we don't want to let people down. Today's a tough day, but a day that, that when it came to me, we come back to you, don't we? Anyway, just hang together, West Virginia. You're almost at the end of this. And please remember all those that we've lost. Thank you so much.